You're ready.
There, are we ready?
Ready.
Good morning, everyone, to this next straight talk. I would call it maybe straight breakfast because it's very early in the UK and in Europe, not so early in Australia on the other side. So I have today Claire Duque. Thank you so much for joining today. And I want to kick that off because, first of all, I need to understand the title Occupational Therapist. Tell me a bit about you, about how you got this passion for what you do. And like a lot of the people who talk about airway, there's always a story to tell why they're so interested in airway. And most likely it is the story of having answers not being given by the professionals. So, Claire, thank you so much for joining today. Please tell us, what are you doing? What is an occupational therapist and why is it so important to link things together?
For sure. Thank you so much for having me today. I definitely do come with a story of personal experience of having a child that has airway issues. But occupational therapy is, a profession where you are helping somebody with a disability or an illness do things that they want to do in life or that they have to do in life. So it's usually skill building sort of a job. I have kind of ventured off into a bit more of a niche area, and this happened only a couple of years ago, and it's due to having a son that was a mystery. And I'm sure lots of parents that will be watching this can probably relate to our story. We had a 4-year-old that was a mystery to a lot of specialists. He had 7 specialists in the space of a year who were trying to figure out sort of what was going on for him. He had symptoms such as, sensory issues, some ADHD kind of issues. He was bedwetting a lot, picky eating, dark circles, irritability.
Can I just stop you here, Claire? Because I would presume by the things you just mentioned that most people would have said, oh, it's normal. That you're bedwetting, that your child is a boy, I presume, yeah?
He's a boy. Yeah,
Yeah,
he's a
that
boy.
boys are very hyper. All of these things you would have probably be thought of, oh, that's absolutely normal. There's nothing we can do about it. So what made you so aware at this young age that nevertheless people telling you that there's nothing wrong with him, that you had a
Yeah.
feeling this, what was it for you as a mother?
Yeah, it's just going back to that gut instinct, you want your child to be thriving. And it's just, you really have to hone in on your gut instinct as a mother and father. And I think for us, we just thought, yeah, he's getting by, but there's just something not quite right. And it was a matter of specialists saying, no, he's just, he's just young, he's just hyperactive. Um, no, he's not yawning all that much, but I remember I took him in to see the second pediatrician, and he yawned about 20 times in that 1 hour session. And that's when the pediatrician said, okay, let's do a sleep study for this little guy.
But I mean, this is already new because you're in Australia. I know you have people like Derek Mahoney in your area. I think there's a much more awareness in Australia actually than I find here in the UK. So I think that was already a good start. But what was for you as a mother the early signs of your child that there might be something wrong? Was it breastfeeding? Was it triads? What were the early signs you've seen in your own child where you made, I think there's something not going the right way? What was it?
Yeah, the early signs for us, looking back with, airway eyes now that are much more knowledgeable, he used to wake a lot at night time. And again, professionals will say, no, that's totally normal. He likes to feed a lot, breastfeeding. And we had a story that involved a long breastfeeding journey. We breastfed for 2 years. But so it's just it's a good reminder to everyone, I guess, that even if somebody is able to breastfeed a child for an extended period of time, it doesn't mean that they aren't a child with airway issues and high arch, narrow palate and, and low tongue posture and all these sorts of things. So looking back now with Airway Eyes, he woke a lot. He'd wake probably once an hour overnight. He wanted to feed all the time. And he just was a little bit more irritable, especially around the age of 4. That's when kind of symptoms really started to show for us. He was, having difficulty nasal breathing. He was, which I, as an OT, looking at a little person, I thought, why is he sleeping with this fully hyperextended neck? So now there's so many mums I ask about that, because we want to look at, we want some easy to pick fruit, I guess, for mums to be able to visually see with their child what might be an issue.
I think there are two things which are really interesting you mentioned. The first thing is, even so you're breastfeeding doesn't mean there's no issue. Hence, with all the knowledge you have, when he was feeding, did you have a feeling that there was enough extraction of milk? Was it the mobility of the tongue that might have caused the issue in feeding? What do you think was the issue in that time, the first 2 years for you, that caused the sleep night? Was it at that age the tongue? Was it the palate? What do you think, with your experience you have now, what was the reason for the struggles for your son to feed properly?
I think with him, it was that he was using it to soothe back to sleep. What I mean by that is I think, is a child that when he would try to go into those deeper sleep stages that we all go through, everything would relax. And for him, because he was so narrow and small in the mouth area, those muscles, the pharyngeal area, the tongue, when everything relaxed, he would, of course, wake up, his body saying, you can't breathe. You need to come out of those deep sleep stages and go into the lighter ones and wake up a little bit. So for him, he's just got a mild posterior tongue tie that we're going to deal with down the track. And I do see a lot of kids with more pronounced ones, but for him, I really feel like he was just being woken up a lot by his body. And then, he doesn't have a correct swallow. So that's another thing for a lot of mums to look out for, gassy babies, restless babies.
What you mean by not a correct swallow? What is a not correct swallow? What do moms need to do to recognize a not correct swallow?
Well, I think if your baby is gassy, if your baby is irritable, if they're struggling to latch, if there's pain when you breastfeed, if there's an issue with milk supply, all these sorts of things warrant connecting with the right people, whether that's a lactation consultant that can fully assess your child's mouth and, for tongue ties and swallow and nasal breathing and all these sorts of things, or a myofunctional therapist, or, someone that knows a lot about airway, then just it brings it back to going with your gut. Not every professional out there is trained on looking out for these things.
So you say very early on after birth, you should consult some professionals who aid you in the way you feed your child. I have a question. Like in orthodontics, you have been trained that genetics outweighs the epigenetics. So meaning the size of the palate is a genetic component. We can't do anything about it. But hearing you just said the palate was narrow and there was already an issue at birth. What is your opinion? Is it the tongue that caused the problems with feeding at the beginning, or was it the narrow palate? Because how narrow can a palate at 0H be? So what was it? Was it the tongue that caused the problem, or was it the narrowness of the palate that caused the problem?
That's a very good question, Dr. Decker. And I think every kid is probably different and warrants a full assessment. For us, our child was born quite retrognathic, which means that the mandible, was quite pushed back, which then takes up his airway space, of course. So for him, right from the get-go, I noticed that. But I think a lot of the time, it can be a tongue tie getting in the way. It can be a thumb sucking habit where the child is perhaps born with a great wide palate, if they're blessed in that way, but then they've started thumb sucking. Or it can be, generally now we all feed our babies that sort of mush pouch food, and we really want to start investigating it as parents, baby-led weaning and getting kids chewing really early on, and getting rid of some of those sippy cups that are out there, and looking at, yes, genetics play a huge role, but also, as you said, epigenetics. We want kids chewing from really early on. We want breastfeeding if possible. We want to get tongue ties looked at, frenums in your mouth looked at. So for us, he was already born quite retracted. So I think that really, I had no idea at that stage,
Exactly.
but looking back now, there's a lot of those sort of clues along the way.
Because my son had infections every 2 weeks, and we were in hospital with tonsillitis every 2 weeks and fever reaction till he was about 4 years old. And only when they removed the tonsils, he became better. So, but I have another question. And the question is, like retrognathing mandible, you could say it's quite normal. But how is the mother? How were you? Did you have any issues in that sort? Is there some tongue tie issue with you in yourself, in your story as a mother? Because my belief is the prevention side of things starts with the mother that wants to have a child. So
Yes.
do you have a story of similar problems and you had treatment for it before you had a child?
I do have a narrow palate. I'm only yeah, 35 millimeters into molar width. So
Huh?
yes, and I have got the crooked teeth on the bottom. And then his dad, you got to point the finger
Yeah.
in both directions. So yeah, definitely. And a lot of the mums that I talk to, because I've gone on to do myofunctional therapy, since this airway passion has exploded in me and our world. And so many of the mums that I talk to have their own, you start talking to them and they realize, oh, that's a symptom that I have or had as a child. And oh my gosh, can you check my mouth as well? And you think, yeah, this is definitely, I'm not a doctor, but it feels like it's genetic plus
But
epigenetic
I
plus,
want to know your gut feeling. We talked a lot about gut feeling. So
yeah.
would you agree with me that your gut feeling tells you we should check the parents as well when we see the children?
Oh, yes, absolutely. Absolutely. And it makes more sense to parents if you're describing their child and symptoms their child is having and talking to them, back and forth about it, and they're able to identify that in themselves or in their own childhood. Then you don't need to do any more explaining to the parent. They're already, wow, this area is worth more than gold to have this knowledge. Um, and it makes sense as somebody that's just joined this fascinating area in the last 2 years. But it makes sense when you look back at skulls 700 years ago, 800 years ago, however long, and you can visually see, we're narrower. It can be anyone that can look at these two skulls and we're already narrower, and then our nasal passages, of course, are smaller. And then we're looking around going, so many kids out there have more allergies, have more ADHD, have more asthma. Of course, there's more pollution in the air, and the nutrients in our food are probably not as dense as they were many years ago. But it's not just people that study this that can recognize what's going on if you dive into it, and it's a really fascinating area, I think.
You mentioned now a few times this word ADHD, also your son. You said at the age of 4, you thought he has ADHD. That's a very young age because he's not at school, he doesn't need to pay attention. He could be just classified as a kid that is super active and running around in the playground all day, every day. I have 3 boys, so I know that's normal with 3 boys, full on action. Why did you say at that early, I'm sure you didn't have a diagnosis of ADHD at 4.
Mm.
Why did you say he had ADHD, and what was it for you that made you believe that?
It was for him, it was his compared to some of his peers, his ability to sit and this nervous energy that he had. And as you said, lots of little boys will have this. It's really hard to question yourself as a mother. Is this something? Is this not something? So
It's
for
also
us,
emotional, I believe, for you as mother. Is there something wrong with my son?
yeah, that's right. Yeah, exactly right. And then, am I doing something wrong? What's happening here? But you've just got to keep searching. And I felt like it was a mystery that needed to be solved. And for him, he had a few things going on. So it wasn't just the hyperactivity and the emotional regulation issues. It was also his immune system was quite. You mentioned your child
Now
as
tell
well.
me everything you found in your son. What were the symptoms for you? I think you have over 10 symptoms that were, in your opinion, hence not quite okay. Can you share them with us? What are these signs that you found in your son?
For sure. Yeah, we had, and I wrote down measures when we started on our airway journey, because I felt, oh, this is definitely what's happening with him. I wrote down things that were distressing him, distressing us, things that were going on for him. And then after we really started treatment, and I can talk about that a bit more if you like, but
Absolutely.
we
I want to know what solved that, of course.
Yeah. So I wrote down what was happening for him and his symptoms. And then I took another measure 3 months later to see, because no one wants to be wasting their time on something that is not resolving anything. So for him, he was bedwetting once a week. And we started his treatment at about 5.5. So between 4 and 5, we had all these specialists engaged and we were trying to figure out what was going on. So he was bedwetting, at least sort of once or twice a week. He was yawning. So I took precise measures because that's just what I wanted to do. He was yawning 8 times on the 20-minute drive to school. He
At what
had,
time was that? At 8 o'clock, or when was that? Which time?
yeah, this was about 8:15 in the morning.
So you
So
had increased yawning.
8 times in a 20-minute trip. Yeah, at 8 in the
Okay.
morning. So, something's not right there.
Okay.
He had sensory issues, so he wasn't able to get a haircut. He couldn't bath at night without feeling nauseous. He couldn't have band-aids or creams on his body. Things again where you think, oh, is that just a 5-year-old behavior? Yes, it probably is, but putting it all together, paints a bigger picture. He's also a child that had tics, oral tics. So that's, making unusual sounds. It's a fascinating area. I really want to get into that a little bit more down the track one day, but making sounds with his mouth, doing shoulder shrugs.
So
Um,
he had literally ticks and making sounds. Interesting.
yes, which would be even things like, lip movements or little squeals, or I mean, they're quite cute and funny, some of them, but it's really not what you want your
But,
5-year-old to be
but
doing.
but this is exactly the point. Like a lot of people, when they sleep with this extended neck you mentioned before, they say, oh, it's cute. Look how my child is cute. Oh, look at the ticks. What, but they, because they have no idea, they had no education, this is a sign of maybe there's a problem. Maybe then it's not so cute anymore. So go on. It's so fascinating.
Yes, it's not cute at all. He was a child that what else? I wrote it down. So prednisone, yeah, you mentioned that. He used to to help control his asthma, he used to have prednisone.
She had asthma.
He had and still has asthma, but it's
Is it
really,
better?
oh,
Can we talk about what you did after? But go on.
yeah.
Yeah, he had asthma.
And I am always yapping away on asthma Facebook groups to anyone that will listen, because I am thinking, your child can be better than this. Let's not ignore the full airway. Let's not just look at tonsils, adenoids, and turbinates in your nose. Let's look at the structure, the bone structure, the muscle function. Let's look at the whole thing. So he had asthma, he was a picky eater, dark circles, all that sort of stuff.
Picky
And
eater. So he he had also sensory issues maybe in his mouth. Would you say that?
yes, I would say that. He did not like to chew. And that makes a lot of sense for a child that has these issues, because, their muscles aren't working properly in their mouth and they haven't got a lot of space. And apart from that, if they're mouth breathing, of course they don't want to chew much. They need that space to breathe. If they're not able to breathe through their nose, they're going to try to get that food down quick so they can take their next little breath.
So mouth breathing, another one.
Mouth breathing, yes, which is, oh boy, that's all improved. So I wrote down all these measures, and
Because my son he had the infections, mouth breathing, picky eater. But it's
right,
so fascinating, interesting. You
yes,
know what we are just doing? We're doing the very early signs of airway issues. That's
right.
super interesting.
Yes, it
But
absolutely
there's
is.
more on your list, I'm sure. But it's so
Oh,
fascinating.
another one that absolutely fascinates me is the rash around the mouth. So we thought it was due to his puffer for his asthma.
Mm.
And then since doing our treatments, there's no more rash around the mouth. Within 3 months after starting, diving into this and really focusing on it, there's been no prednisone. That's a year and a half of no prednisone, going from every 2 to 3 months. These are significant changes. There's 2 yawns. 3 months later, there was 2 yawns on the drive to school instead of 8. There was once a month bedwetting instead of 1 to 2 times a week. There was haircuts. Oh, no worries. Love haircuts. Could bathe at night because he wouldn't feel sick. These are all measurable things.
Okay, now we need to know what have you done. I mean, if your son changed so much, what is it we need to do to help kids?
Mm. It's
And
it's a,
it's so
it's a
fascinating.
complicated area, but it's so worth putting in the time. So what started this was I saw a video from Dr. Marielli, who's an occupational therapist and a orofacial myofunctional therapist as well. So mouth and face myofunctional, which is muscle function therapy. And I saw a video that she put up, and I remember sitting on the floor watching this 30-minute video, jaw on the ground, thinking, this is my son. So I watched it again the next day, and that's what set us off into the path of finding out what was really going on. He had his adenoids out and his turbinates in his nose reduced.
What age was that?
He actually had that at about 5, and so that was before we started.
And was that adenoids removal because you pushed for it, or was it referred by the GP and after so many infections, that is why they removed the adenoids? Who took charge in this decision to remove the adenoids?
We saw an ENT and she said, no, it's all fine. We saw another ENT and he was agreeable to remove them. And I know that's not for every family, you know, it's case by case, depending on what you want to do. For our son, it was life-changing.
But that means even you go to professionals, you get different opinions. So that
Yes.
is, I think parents need to be aware, because for me it was exactly the same. My son had tonsillitis every 2 weeks. Nobody wanted to do everything. Finally, after a year, they got the diagnosis of PFA-PA syndrome, which is an infection of the airway. And when we moved to England, nobody knew that. And at one point, we found ENT who recognized that syndrome, who knew about it. And he said, yes, we have to remove the tonsils. So he did. And then it became better. But all the rest of the professionals had no idea. They gave us antibiotics every 2 weeks, which killed the gut. So,
Yeah.
it is really, like you said, you go to different professionals. They give you, again, different opinions, which makes you
Yeah.
feel insecure. And you continue going with your gut feeling that I need to do something. I think that's a really important message out there.
Yes. And then he started to grow. You know, he hadn't grown for 6 months. This is a 4.5, 5-year-old that wasn't growing. And that was the
Wow.
first gold
So again,
nugget.
I'm an orthodontist focusing on growth and development. So the minute you open his airway by removing the adenoids, you as
Yeah.
a mother, you notice growth.
Growth, a happier child, less irritable, and oh my gosh. And I just thought, you know, and also the hyperextension pretty much straight away went. This is 2 weeks post-surgery. He was a different sort of a child. That
So
was the
his hypertension, you say, to position he was sleeping, extending his neck, which is a sign for sleeping disorder, changed the minute you had these adenoids removed.
yes,
Wow.
yes. And that was a gold nugget clue. I call it that this, you know, that most of his issues were airway related. And then I saw that video. And then I really honed in on getting his allergies sorted. For us, that was immunotherapy, which is a little spray under the tongue for, you know, it took probably 4 months to actually start working, but that allowed him to nasal breathe, which is another big treatment out of the number of treatments that we did for him.
What
And
treatment
after,
was that? What did you do to make this child, your son, suddenly breathe through his nose? What did you do?
so we went to an allergist, and the allergist gave us a spray, and I think for adults you can choose a needle once a month to help. It's like a graded exposure for your allergen. For my son, it's dust mites and pet dander, just like his dad. But anyways, and he had a sublingual spray every day. So it's a 3-year treatment in our case. And it starts working for some kids around that sort of 4 to 6 month mark. And that was us. So that meant that he didn't have that runny nose all the time that a lot of kids get with allergy, that clear, liquidy, wet nose. So that made his nasal breathing a lot easier for him. And after this, we started what I think is one of the biggest helpers for a child that has sleep disorder, breathing, and airway issues. And this is your domain, I think. This is palate expansion, or getting that, you know, that palate.
How old was
Wide.
he then?
He was 5.5 then, and I wish we'd started earlier.
So at 5.5, you start seeing an orthodontist, yes?
Yes,
And he started widening the palate.
correct.
How did he
Yes.
do that?
We did it with a removable appliance, so a Schwartz removable.
A Schwartz is an acrylic device with a screw that you had to turn once a week. Yeah,
Yes, I've got it here.
perfect.
Yes.
So
So
that's the,
we got
I see. Yeah. So
this
that
one
is
here.
also, can you show us the screw a bit closer with where your finger is?
That's the bottom. I will try. We've
So look,
actually
like
fused.
this
We've
is
actually
actually a screw that has two dimensions. It goes forward and sometimes they go out. So that's basically an expansion device that going transverse and forward, backward. So it opens the whole arch in two dimensions. And the lower is also the expansion device. It's called the Fisher's or the Schwartz expander, which goes in a transverse. So this is the very early science. And this is exactly what I do or used to do because nowadays you can do new technology, which is an aligner. Like clear liners, when you compare this device you just shown with a clear liner is much more comfortable, and hence kids love it more, and hence they wear it more, and hence we can change these clear liners much more frequently and get quicker a result. So that's really interesting. So the tool is actually the same, it's just a different technology. So so what happened then? You widen now the arches, the dental arches, and what changed?
So we got these little teeth with some gaps in them. These are his little
So
stuff.
before that, your son had no gaps, right?
No gaps. This is his bottom jaw, his bottom teeth.
Yeah.
No gaps at all. So we took
And
more
can you put
mold.
them together? Can you put these models together?
Yeah.
Because it
And
would
look at
be
it,
interesting.
a high arch. It's really, I can put my whole thumb in his little archway, which is, the top of our jaw, which was also the floor of our nose. So putting these together,
It's tiny.
tiny. It was only, he was very narrow, 21 intermolar width as a 5.5-year-old.
Yeah, very nice. And let me ask you a question because I look at this and I diagnose immediately. Was your son grinding at night? Tooth
Um,
grinding?
yes,
He was grinding.
yes.
That's
Which is another one for parents that we mentioned because that's something they can hear. And as parents,
that's
we want,
why I say that.
yes, we want things we can see, we want things we can hear. And when I talk to parents, the gaps between the teeth is such a great one to talk to parents about because it's something that makes sense. Of course, it needs to be wider. So we love all those sorts of visual
So your
things.
son was snoring? Yes.
Yes,
Your son had a hypertension of his neck.
yes,
He was grinding.
yes,
He was mouth breathing.
he
He
was.
was bedwetting.
Mm-hmm.
He had hyperactivity, sensory issues, picky eater. Did I miss something?
Probably. There was,
But
no, that,
there are some of the key things,
yeah,
ADHD.
yes,
So there are already such an important keys here for
yeah,
mom out
yes,
there to recognize.
that's right. Yeah. And I think as an OT, the sensory processing side of things is really interesting because it's hard to make that link to an airway issue, but it makes sense when you talk about it because and I hope that there's
Explain.
more.
You need to explain it to me. Why does it make sense
Sure.
to you?
Yeah, and I saw it firsthand with my child, symptoms resolved. But if a child is not going through their correct sleep stages and having restful, restorative sleep, where the brain does all the things that the brain needs to do, because every sleep stage has its purpose, and the deep sleep stages are where you do a lot of if you're a child, your building blocks of the day. You make sense of the world, you grow your neural pathways, you consolidate your learning of what you've learned that day at school or in daycare or wherever it is. And I like to talk about it like it's a brick wall that you're putting a brick on top of a brick. Child goes to sleep, consolidates their learning, integrates what they've learned, and you put a brick on top of a brick again and make these beautiful neural pathways. If a child is not going into those sleep stages and being woken up because of structural issues, muscle issues, of course, their body is not going to be worrying about interpreting senses correctly or integrating the senses correctly because they're in fight or flight mode. So, you have a child that's then in the sympathetic nervous system state that's more worried about just trying to breathe at night rather than consolidate all that learning in a way that makes sense for the brain and for growing these neural pathways.
I love that comparison of building a brick wall, or how did you call it?
Building a neural pathway. So
You're
you,
building a neural pathway in falling into deep sleep, collecting your thoughts at night. And if you don't follow it, the whole pathway will break because you're missing some bricks in there.
That's exactly right. And for kids, they do so much of their, and again, I hope some OTs out there will hear this, but we do a lot of work with kids on executive functioning skills, which is like memory, planning, it's problem solving, it's sequencing tasks. And if you've got a child that's not able to get into those deep sleeps and do that learning consolidation, then you're asking a child to problem solve or remember or sequence their tasks or whatever it is, and they're not able to because they haven't laid down those building blocks, those bricks.
That's so fascinating. I love that comparison.
Yeah, yeah. So these are good kids. They just have crap airways.
So,
um,
I mean, now you have this issue in your profession. So what is your first, when you have these kids and you have a mother who comes with you with the sensory issues and all these things, what's your first steps you take in your profession to eventually address that there's an issue with the airway? Because I presume it's similar to me. That will be the first time a parent hears about the connection. So how do you approach this topic with your clients?
well, I've gone into myofunctional therapy now, so all the people I see have already kind of heard a little bit about airway, but I would invite other OTs that are working in different areas to, use some of the checklists that are out there. There's Dr. Mark Levi has one on kids with sleep disorder breathing. It's just red flags. I've got one on my Instagram as well, but you can use this
What is your
to
Instagram that if we want to follow you? What's your
sure,
Instagram?
airway sleep therapy, because I just think, so much of a child's health and well-being is around their airway and their sleep, and of course nutrition. So I've called it airway sleep therapy. And so I'd just say, if you're not sure yourself as a health professional, use some of those checklists that are out there and then refer on to people that can help. But there's no reason why health professionals can't be screening for sleep disorder breathing. Even if they're not sure, how do I treat this? What do I do?
And what would you say, what is the age you should be screening for kid for these sleep disorder breathing things? What is the age? What would you say?
As early as you can probably answer that better than me, but I'd say as early as possible,
No, but
before
it's
you have.
important that people know a different opinion because I agree that the minute they're born, you need to screen for these things, and you pointed it all out. And I want to go in a different direction about therapy as an OT. What do you think of MyoBrace and Froggy Mouth and all of these devices you can get relatively easy? Are they effective? When are they effective? And when are they maybe not effective? So do you have any experience on these devices that people give early on?
I think it depends very much on the child. The reason I say this is we have bought some of them for my son in the past, and he has not been receptive to them, to some of
Was
them.
it because of the sensory issues or what was the problem?
It was because he was still a bit irritable, I think. Some children are more, I tried the remaster straw with a child the other day, and she loved it, but my son won't touch it. So you have to have a bit of a toolbox as a person that works in this space, you have to have, you know, an array of things, because not every child is going to like the same thing. And I think that these tools are great, but they don't replace doing the myofunctional exercises, and you know, certainly don't replace, if a child is needing it, expansion or aligners, or you need to work very closely with, as you talk about all the time, and I love that you do, with a variety of specialists. You know, none of us are going to know everything in this area. So
And for your son with sensory issues, the screw, the device that expanded your jaw, did he cope with them well? Did he like it? Did he not like it? What was your experience in that journey of expansion?
so surprising. Getting him in the chair was hard. We had to use all the bribes in the world, and but when it was in his mouth, he thought, this is okay. He said, this is actually okay. And within, you know, a couple of weeks of active expansion, he loved it. And I'll tell you why. He
Mhm.
loved it because he felt better.
So he
He
himself felt
yeah,
change.
he felt change within himself. We could see it visually, you know, we could see his venous pooling was getting better. He was less irritable, all these sorts of things we talked about. But he within himself felt better. And I'll never forget what he said when I said, you know, do you feel better? Do you feel different? And he said, oh yeah, much better, just like that. And he was quite genuine in that. And he talks
What
about
age was this?
this was 5.5, we started his expander. Yeah, yeah. So he just felt a lot better. Um, and so now he goes along, you know, he's not that excited to get all his appointments done, but you can sort of explain to him.
How old is he now?
He's just turned 7 now. So
It's
just
fascinating because you are at the end of your journey with expansion, while most people listening to us have not even started the journey.
get excited. I like to hold a lot of hope for parents and get parents excited, because, you know, their child's only going to be better for this. And I always say to parents, just rule it in or out. It doesn't hurt, you know, to rule it in or out as an issue for your child. And also just making parents aware that it's a multifaceted area. So you're going to need, even if you get the widest, most beautiful palate in the world, you know, if you have a child that is blocked up with allergies, adenoids, they're still not going to be able to nasal breathe. If you have a child that has this beautiful wide palate from expansion, if their tongue is still low tongue posture, then, you know, it's going to be waking them up at night potentially. If that tongue is held down by a tongue tie, then it's not going to be able to do what it needs to do. You want to be working with a body worker or a chiropractor, an allergist, an ENT, an orthodontist. So there's going to be a lot of people in your team, but there is nothing more worthwhile than figuring this out for your child, and as early as possible, because like I said in the beginning, this knowledge is worth more than gold.
I love that. Was a nice summary actually. But I have a question for you. If you could describe what's your biggest wish for all the people, because the reason why we talk is because we want the same thing. We want education. We want to spread the message of prevention. What would you say is your key message to the people out there if you could change the world?
Start early. Start early, because a lot of these issues in a child can be, you know, you can put that child on a different trajectory potentially for their life. Not every child, but you can make real changes. So start early, trust your gut, and put a team around you that you can talk to, that you trust, and that are not sort of shutting you down.
Would you say you felt a lot of emotion? I feel your emotion. when we
Yeah,
talk
good.
about this. Um, and I share the same happened to my son. It's because
Mm.
mostly you get antibiotics, you get symptomatic treatment. So I think you summarized it really well. So if there would be a question you wanted to ask someone like me as an orthodontist, what would you ask? What would you want to know from me, which you couldn't answer before? Now it's your time to show it. What is it?
Gosh, I am very interested in, um, oh, gee, I guess maybe, do a lot of your kids that you see, do a lot of them have gut issues as well? Or, you know, tummy issues, or what's your thoughts on that?
Well, actually, because I'm in London, there is a dentist called Victoria Sampson. And Victoria Sampson, I work with in London, she does all microbiome tests for every patient. And she looks at the bacteria in the oral microbiome because it has a direct link to the gut, because you swallow these bacteria. And she will be probably a good partner for you to hook up in a podcast, Victoria Sampson in London, because she's at the forefront of research in terms of oral microbiome. But to answer your question, when patients come to you as an orthodontist, they come generally to you for teeth because something is wrong with their teeth.
Mm,
Then you open this whole thing with airway because you ask certain questions because you see signs. Then you will
mm,
get emotions because they recognize themselves, they recognize the story, everything you mentioned today, what happened in the past, and they didn't get the answers. So I link that and give them the answers. And when you have that emotion, me as a professional, I need to eventually stop talking because I had enough emotion that they can't cope with more. They are overwhelmed already with the information they got. So I very rarely can talk about gut because I already talked about so much more things than gut
yes.
that I have to stop. And then during the treatments, then when we get to know each other a bit more, I can go deeper and deeper about posture and all of the rest that has impact in breathing. So the gut itself is not my focus right now. I know about it. And yes, they have gut issues, but there are people like Victoria Sampson London who literally focus on this bacteria in the mouth. Because again, if you think about it, where mouth breathing will change the whole microbiome and hence
Mm-mm.
it will change your gut. And
Yes.
when you treat symptomatic with antibiotics, which a lot of kids get, then you
Mm,
kill your gut.
mm.
So that
Yes.
means that the gut bacteria have never the time to develop into a good gut, and that can cause all sorts of issues and gut
Yes.
leaking and all of things. So I think there's a huge, huge area that is
Yeah.
actually not even understood yet in
Yeah.
that. So, but the thing is also is question is how deep can you go in these areas because also it is emotional and you for me it's about setting the priorities like what is the most important and for me breathing is the absolute priority and also
Yes.
Katie Lee in her book Saved by the Mouse talks about the gut, so that's a really good book to read about the connection between all microbiome and gut. So she points out a lot of research. I interviewed her before. So Katie Lee is a good partner, Victoria Sampson, to talk about the gut. But for me, the priority in my consultation is health and airway because it
Yes.
starts with that.
Yes, and it's so interesting that there's so many areas of health that you can link back to airway. For example, cardiologists out there working, with heart, the clear link of sleep apnea and high blood pressure and the loosening of cardiac fibers, and as you mentioned, the gut, the linkage with microbiome and airway issues and sleep, and ADHD, the link, and then you've got, sensory processing disorder, the link. It really links immunity, it really links to so many systems, all the systems of our body, um, brain health, all that sort of stuff. So I hope that down the track, there's more emphasis out in the health space, put on early intervention for sleep airway issues, because the more I learn about this, the more you can see that so much of these chronic health issues out there are linked, and even mental health. I worked in mental health as an OT for 13 years, and I still work in that space a little bit. And the adults I talk to, so many of them have malocclusion, so many of them are waking up, sleep apnea, so many of them talk about getting up at night, and of course, their nervous system is on all the time. They're in fight or flight, for many years chronically. So these are adults that I just think, would the trajectory of their life have changed had they received early intervention? Maybe not, but maybe.
I think I think that's a perfect thing to stop, because we talked about adults and mental health. Potentially, could prevention have solved this? Maybe, maybe not. That's a question I think for our audience to answer. And I want to thank you from the bottom of my heart, because I think there were so many gold nuggets in today, especially from your own story of your son. I hope he's good now. And like, my son is much better, and I treat him now with expansion and everything you mentioned.
Yes,
So I think
much
detecting
better.
the early signs is key, and we need much more professionals out there who actually focus on these early signs to avoid mental health in adults and all the rest of it. I mean,
Yes.
it's so big that we don't even understand it. Claire, thank you so much for taking the
Thank you so
time
much.
today.
Thank you for having me, Dr. Decker, and for all you do.
Thank you so much, and I hope we see one day.
Yes.
Have a
Thanks.
nice day. Thank you so
You
much.
too. Bye.